Namaskar, I am Dr. Manish Dey. My name is Dr. Manish Dey. Today my topic is on knee pain. So I've discussed about back pain, I've discussed about different kinds of cancer pain, different types of pain that is relevant. And now today I am focusing on the very common symptom that many patients come to me for is the knee pain. Now, knee pain is a mixed kind of disease. There are a lot of specialists who actually take care of knee pain. One is rheumatologist for the rheumatoid arthritis, one are the orthopedicians for the knee osteoarthritis, and there are various other knee problems like some ligament tear or any kind of bursitis. Those are treated by both orthopedicians, rheumatologists, and obviously us, the interventional pain physicians. So, the knee pain, we have to locate the source and then identify what are the main pain generators, and then according to treat the symptoms as per the source. So, knee pain commonly occur in the older population like 50, 60, 70 years, mostly females, and the most common cause being osteoarthritis. And here we actually try to identify whether it is the osteoarthritis or some other kind of disease. We have to differentiate from other kind of problems like rheumatoid arthritis, uric acid, high uric acid, any kind of bursitis and all, or is there any acute flare up of osteoarthritis. So osteoarthritis is a degenerative condition, like our hair becomes gray and all like that. The cartilage, that is the small layer just outside the bone, just outside the bone around the joints, gradually degenerates with age. So we will all have the symptom and all have the diagnosis of osteoarthritis in later stage of our lives, but that should not be causing incapability to walk or inability to do some household work and all. So the person who is suffering from osteoarthritis should be able to do his daily chores and also do some household activities. So that is our target. So once the osteoarthritis sets in, it is divided into 4 phases. So the difficulties the people face with knee pain is difficulty in climbing upstairs, sitting cross-legged, walking in fact, and those can lead to some other systemic disease like diabetes, hypertension, dyslipidemia, high cholesterol. Those are actually kinds of leads to some lifestyle diseases. So what our aim is in knee pain, mostly due to osteoarthritis, is to improve the lifestyle and also to improve the daily activities. So for osteoarthritis, first is the diagnosis, what stage it is. We check the patient, take the history, any kind of swelling, any kind of problems in walking, and check the joint whether there is any crackles inside, there is swelling or redness or any tenderness on palpation, and then we go for an X-ray. And after an X-ray, we confirm the diagnosis of osteoarthritis and what grade it is. It is actually the final grade, or grade 4, or it is in grade 1 or 2. And accordingly, we can actually have some interventions in place. If it is not relieved by the conventional medications, if there is a burning pain, we usually start with some anti-neuropathic medicines and then give some quadriceps strengthening exercise. After that, usually the pain subsides in most of the patients, but some patients do complain of pain and inability to walk even after the initial management with medications and physiotherapy and exercise. So then we go for the interventions according to the stage of the disease, and if it's stage 1 or stage 2 of osteoarthritis, then we go for some injections known as the platelet-rich plasma, which is a patient's own blood being centrifuged, and then the platelet-rich portion of the blood is being injected to the patient itself inside the joint in a sterile manner in an operation theatre setup under local anesthesia. And also it can be supplemented with some kind of steroids if needed in future, but mostly PRP therapies may require 1 or 2 sessions at a gap of 1 month, and usually the patients get relieved well with this kind of therapy. This usually provides the growth factors responsible for reduction of pain around the region. It's kind of a regenerative therapy. And there are a lot of newer agents like stem cell therapy, like stem cell injections, or in case some growth factors also have come in place, growth factor concentrates, which are better than PRPs, but a bit of cost difference is there. But again, those are very useful regenerative therapies for osteoarthritis who are suffering from knee pain. And in higher grades like grade 3 or 4, there is some kind of injections are available which are intraarticular hyaluronic acid, that is the lubricant which is found in the knee, which is synthesized outside and it is being injected into the knee joint itself. And this is one kind of injection which usually relieves the pain for a 6 month or a year. and the last injection, which is the genicular nerve block, which is very much useful in some selected populations where the knee joint replacement is actually contraindicated, or the patient has refused for knee joint replacement, or there is some problems from the surgical side where the knee joint replacement is not possible. Then we usually go for the genicular nerve block. We usually inject in 3 places around the knee, if you can see in the photo given along with this video. And after the genicular nerves are identified by electric current stimulus, stimulating the electric current, then we give an radio frequency ablation, that is the burning of the nerves. So those actually cause relief of pain, but with ability to walk. So we only inject to the nerves which actually carry the pain rather than carry the other sensations of walking. So only the pain sensation is cut off and the other sensation of walking is preserved. So that's how we can actually scientifically reduce the pain in a patient of chronic knee osteoarthritis, and improve the daily habits, improve the lifestyle, and thereby improving the quality of life. So this is one of the common problems the patients face, knee pain, mostly due to osteoarthritis, but yes, rheumatoid arthritis, bursitis, popliteal cyst, these are all differential diagnoses which has to be kept in mind. In fact, red flag signs are also important, like some complete tear of the ligaments which are present around in and around the knee joint. So we have to investigate by X-ray, and if required, ultrasound and MRI. And if there is a partial tear, there is still some response to PRP and regenerative therapies. But most of the cases, if there is complete tear and if there is complete knee osteoarthritis, fusion of the joint, deformity of the joint, and higher grade of knee osteoarthritis, TKR or knee replacement is one of the best options to treat those conditions. But in those selected populations where even in higher grades, the osteoarthritis patients do refuse for the knee joint replacements and they are not fit for surgery, or there is some problem from the surgical side, we usually can relieve the pain for a temporary period of 6 months to a year by this hyaluronic acid injection, that is the lubricant that is injected intraarticularly, and by the genicular nerve blocks. So take home message from this video is that patients who are suffering from knee joint pain should visit their pain physicians to actually diagnose the problem, whether it's rheumatological in origin, whether it's a bursitis, whether it's a popliteal cyst, or whether it's a ligament tear, or whether it's a knee joint osteoarthritis. And according to the diagnosis, there should be a customized treatment and individualized basis. And after proper counseling and explaining the risks and benefit of the procedure, we can actually have some oral medications, physiotherapy, exercise, and different kind of intervention as discussed above. So if you have any questions, please let me know in this video and I will answer it as much as possible. Thank you. Take care.